Good morning, and thank you for joining us for the third annual Stakeholders meeting of the MetroHealth system. I am Tom McDonald, Chairman of Metro's Board of Trustees. It is very gratifying to be here to welcome you today. The purpose of these meetings is to provide you, our stakeholders, supporters, and friends with an update on the state of the MetroHealth system, our accomplishments during the past year, our plans to improve the health of our community, and our plans to transform the delivery of care throughout Cuyahoga County. And while I could not be here in person, I am pleased to introduce special messages Metro has received from our United States Senators, Sherrod Brown and Rob Portman.
I'm Sherrod Brown. It's a privilege to serve as a United States Senator. Thank you to Tom McDonald, to Dr. Boutros, and everyone at Metro for your service to this hospital and to our great city. MetroHealth is a pillar of our Cleveland community. You're recognized by everyone for the great work you do for Ohioans. Senator Portman and I have worked together to make sure you have the resources you need and that your commitment to quality care for all Clevelanders, regardless of ability to pay, is recognized. Nowhere has that commitment to care been clearer than through your advocacy for Ohioans on Medicaid. You were among the pioneers in our state in expanding Medicaid. Because of your work and because of the Affordable Care Act, some 600,000 Ohioans now have health insurance. Many of them, as you know so well, you meet these patients, many of them for the first time in their lives. But the misnamed Healthy Ohio program, brought to us by the legislature and the governor, would roll back the progress we've made and would increase health care costs for up to 1 million Ohioans. Once the state submits its proposal, the decision will be in the hands of the Centers for Medicaid and Medicare Services. I want to thank all of you at Metro, and I've spoken to Dr. Boutros and a number of doctors and nurses and other practitioners at Metro. I want to thank you for all that you've done to weigh in on this dangerous plan. It will affect tens and tens of thousands of patients, all of whom will now have Medicaid, but might not have it if this waiver is granted. CMS needs to hear the story of these patients. When they do, I hope they'll do the right thing and reject this misguided plan. We can't be dragged backwards, particularly at a time when we're working together to make progress in some of our state's persistent health issues. Our state still ranks 45th in the nation when it comes to infant mortality, close to last for African-American infant mortality. That is shameful. It's shameful when the legislature cuts funding for Planned Parenthood. It's shameful when the governor and the legislature try to slice back the gains we made in Medicaid. And why would we expect we can get better when our ranking is so abysmal on infant mortality? We're working to ensure that pregnant women get prenatal coverage through the federal exchanges, coverage we know is essential to improving birth outcomes. Together, we work to ensure our country has the capacity and the funding necessary to fight emerging infectious disease. I know you'll continue your advocacy while providing quality health care with compassion and respect, no matter the patient's ability to pay. For that, I am so grateful to what MetroHealth does for the city I call home, for our entire community in Northeast Ohio. I look forward to seeing you next year at this event, and I look forward to our continued work together.
Hi, I'm U.S. Senator Rob Portman. I wish I could be with you today at your annual meeting, but I'm with you in spirit as you lead the way to a healthier community through service, teaching, discovery, and teamwork. That's a great motto. And by the way, you've been doing it since 1837. Unbelievable. Special thanks to Dr. Boutros for his leadership. I'd like to congratulate MetroHealth for helping keep Cleveland healthy all those years. MetroHealth is playing a critical role today, of course, with more than 20 locations around the community. I'm especially grateful that MetroHealth has been so supportive of the efforts to respond to this opioid addiction epidemic that's devastating our communities. You see the consequences of that epidemic every single day, and I know that Cleveland has been hit hard, especially hard by this epidemic. We think the overdose rate in Cleveland is on pace to double this year. Through valuable advice and feedback, MetroHealth has also helped make what's called the Comprehensive Addiction and Recovery Act even better. This is legislation that I introduced a few years ago, and in March, it passed the United States Senate by a 94-1 vote. That never happens in the United States Senate. But it happened this time because we put forward a comprehensive, common sense solution, and because this issue is affecting every single state in America. Thank you for the role you played in helping us put together good legislation. Last month, I actually visited Project Dawn, which is a clinic where, as you know, physicians and staff from MetroHealth and the free clinic work. Through community-based prevention and education, you're helping to stop addiction before it even starts. And through providing better treatment, you're helping to deal with those who are addicted. I believe prevention's, of course, an incredibly important way to keep our communities drug-free and healthy. And I also believe we need better and more accessible treatment and longer-term recovery. So I thank you, and I thank especially everyone at Project Dawn. I also want to thank everyone at MetroHealth for doing their part in preparing for this summer's Republican National Convention. I'm looking forward to showing off Cleveland to about 50,000 visitors in July, and knowing you're there gives everybody additional comfort and some peace of mind. So I wish you a very productive meeting and many more years of success. Thanks for what you're doing. Godspeed in your important work.
Thank you, Senators Brown and Portman, for your support. And now, I'd like to introduce a unique presentation that we hope will show you something new about MetroHealth, where we are, what we do, and most importantly, who we are. Thank you.
Welcome to MetroHealth's third annual meeting.
Runway 19er, wind 240, 112, altimeter 206. At 1,500 foot for the approach.
You might think of MetroHealth as the county hospital or the premier Level 1 trauma center in Cleveland. You might think of us as the hospital just west of downtown, visible from I-71 at the MetroHealth curve. We are so much more. We have more than 20 facilities and provide patient care at many other locations across Cuyahoga County and beyond. We now have 3 emergency departments to serve urgent health care needs at our main campus, in Parma, and in Cleveland Heights. And this summer, when our new Brecksville facility opens, we'll add a 4th ED, making access to our expert emergency care more accessible to all. We also provide care to children at more than a dozen Cleveland City schools. Our school health program ensures these children get the checkups and immunizations they need to stay healthy. We provide express care services for common ailments like cold and flu symptoms, ear, throat, and sinus infections, sprains and strains, and much more at 6 locations. And walk-in clinics at several discount Drug Mart stores in Cuyahoga County make access to care quick and easy with more locations planned. We even take care of incarcerated patients through our correctional health program. Our renowned Metro Life Flight crews and helicopters are based in key locations, so we're able to quickly get the most seriously ill and injured patients to our verified Level 1 trauma center for life-saving treatment. Now that we've shown you where we are and what we do, let us show you who we are.
We are the resilient ones. Our mission lifts us up, inspires us to improve the health of all who live here.
Because the health of everyone in our community matters.
This steadfast pledge to the well-being of all people without discrimination lives deep in the heart of everyone who works here.
Together, we innovate, educate, and transform. We're not afraid to challenge the status quo.
We will continue to put people in our community first, because for us, it has always been the right thing to do.
We are knocking down the walls of convention, boldly redefining the delivery of care. Because right now, healthcare can't afford business as usual.
We believe in collaboration, for ours cannot be a truly great city for health without all of us working together.
Our work to improve the health of every single person in our community is too important to remain hidden in the shadow of giants.
But we don't do it for the glory. We do it for everyone in Cuyahoga County.
We are exceptional clinicians with extraordinary hearts.
We are MetroHealth.
Hello, I'm Akram Boutros, President and CEO of the MetroHealth System. We are so pleased that you could join us today as we provide an update on MetroHealth and where we stand with our efforts to transform the delivery of healthcare in Cuyahoga County. In our continuing commitment to transparency, we are happy to share information with you about our accomplishments and future plans. Now let me introduce you to a man who goes with me everywhere I go as we improve healthcare for everyone in Cuyahoga County. Your favorite guy and mine, Dr. Akram Boutros. Now that you're here, it's time for me to take my leave. Bye-bye. As you just heard from some of my colleagues, members of the MetroHealth family, we are the resilient ones. MetroHealth is one of the oldest surviving institutions in Cleveland. It's older than the Cleveland Public Library, older than the Dunham Tavern and Lakeview Cemetery, older than the Old Stone Church. We were founded in 1837, 1 year after the city of Cleveland was incorporated, with the same noble mission that gives us purpose today, caring for everyone, caring for those of us who are gathered here today, blessed by a roof over our heads, good food and friendship, and caring for the lonely, the abandoned, the forgotten. That mission has lifted the MetroHealth community every day for everyone of the past 179 years. It lifted us up when we triumphed over cholera in the 1830s, when we saved thousands from tuberculosis after the Great Depression, when we gave life and limb back to those stricken by polio in the 1950s. But those seem like distant memories. Our recent past tells a more precarious story. In 2011, an international strategy and consulting firm delivered to the MetroHealth Board of Trustees a 5-year forecast. With declining operating revenue, Medicaid cuts, and a smaller county subsidy, that report said MetroHealth would end 2015 more than $40 million in the red. Those experts told us we could break even. We might break even if we fired 700 employees. That was on top of the 600 jobs that had already been cut. Our trustees were left with 3 options. They could wind down operations, they could sell to a competitor, or they could reinvent MetroHealth. They could create a healthcare system that's more vital and more valuable to our community. They chose option 3. They went to work. We all went to work, and together we beat the odds. In 2015, instead of being more than $40 million in the red, we ended the year with $29.8 million in operating income. That's money in the bank. It's $70 million better than those forecasters predicted. And it was our 5th straight year of operating in the black. And instead of 17 locations we had in 2011, today we operate 26 health centers, immediate care facilities, and other locations where MetroHealth care is available to anyone and everyone in our community. In 2015, we delivered that care more than 1.1 million times. Those 1.1 million visits don't include the care we provided and continue to provide to students in the 14 Cleveland public schools, at the Cuyahoga County Jail, the Cuyahoga County Juvenile Detention Center, Recovery Resources, Malachi Center, Providence House, and in nursing homes and federally qualified health centers all over Cuyahoga County. When you add those in, the number of locations from which MetroHealth delivers on our mission totals 73. We did more in 2015 than defy the odds. What we accomplished, all of us at MetroHealth, would be almost unbelievable for any organization, but especially remarkable for our county healthcare system today, at a time when so many are closing their doors, curtailing services, and being swallowed by competitors. Our list of 2015 achievements begins with the expansion of our emergency services. High-level services delivered by the only hospital system in Cleveland with a verified Level 1 adult trauma center. Our 2015 negotiations with HealthSpan laid the groundwork for 2 new emergency departments in Cleveland Heights and Parma. Without our expansion, those former urgent care centers would have sat empty, and ill and injured people would have had to travel farther and wait longer for their care. Now, residents of those communities have round-the-clock access to highly trained and certified staff, and they receive care in emergency departments that are part of the Northern Ohio Trauma System, our life-saving collaboration with the Cleveland Clinic and Southwest General that makes sure severely and ill and injured patients get to the right hospital for the right care in the quickest time. We'll add a 4th emergency department later this year with the opening of our Brecksville Health Center. This new bedless hospital is an advanced outpatient center that offers a combination of imaging and laboratory services, emergency care, surgical care in high-tech operating rooms, and facilities for primary care and specialty care, as well as a short-term observation unit, but no inpatient beds. Another major achievement for us in 2015 was the expansion of our critical care pavilion. This state-of-the-art facility will begin accepting patients on July 6th. It's an $82 million project that's on time and on budget. It's a facility that did not cost taxpayers 1 penny. MetroHealth paid for it with savings that come from smart strategic business decisions and well-managed care. The 2 new floors include 85 of the most modern intensive care rooms in the region. Rooms that are ready to handle any emergency, natural or man-made, including those that result in mass illness or injury. Also included in the expansion is the most advanced Ebola treatment center in the United States. In 2015, we made healthcare more convenient and accessible in other ways. We opened new pharmacies in our Broadway and Middleburg Heights centers, bringing our total number of pharmacies to 5. And we'll open 4 more before the end of this year. We also established 3 walk-in clinics in discount Drug Mart stores in Independence, North Olmsted, and Parma Heights. These are clinics where everyone, whether or not they have insurance or money, can receive non-urgent care and preventive services. It's important to note that the MetroHealth transformation isn't just physical. It's operational and clinical too. In addition to opening new facilities, we're transforming the way we deliver care to our patients and the way we do business. That includes our move towards population health. This term gets tossed around a lot without explanation. For us, it means improving the health of every resident of Cuyahoga County. We do that by focusing on prevention, by providing proactive, team-based management of disease, and by delivering foresighted, coordinated care to everyone. It's offering the kind of services that keep people out of the hospital. This alternative to fee-for-service care means patients pay less to stay well instead of more to try to get well. It's preventing problems early on before they get worse, and it's the future of healthcare. MetroHealth is perfectly poised to lead the way in delivering these programs. We have a track record of success as evidenced by our innovative Medicaid expansion pilot program, MetroHealth Care Plus. In that program, we improved the health of 28,000 patients. And we did it while spending 29% less than the government allowed. In the end, we improved health, reduced suffering, and saved the state and federal government $41 million. We're staying relevant in many other ways too, and one of the biggest is in creating jobs. In the 3 years that ended on December 31st, 2015, we hired 604 additional employees. That doesn't count the hundreds of construction jobs our critical care pavilion expansion added, and it doesn't count the additional 400 employees we hired in 2016 with our move into 4 former HealthSpan locations. So you see, we provide good jobs with solid benefits to all those people while continuing our commitment to diversity. 32% of the nurses we hired were from underrepresented minorities. And of the managers and physicians we hired last year, 69% were diverse. In 2015, we also increased our starting pay. Today, no MetroHealth employee earns less than $12 an hour. It was also one more year in which MetroHealth invested in the social support infrastructure of Cuyahoga County. We know that no person or community can remain physically healthy without the societal benefits that allow for that good health. Things like safe homes, clean air, good schools, and nutritious food. That's why we're creating a gun violence program that has brought lasting peace to other communities. This collaboration with the City of Cleveland, the Boys and Girls Club of Cleveland, and the Northern Ohio Trauma System will work in 2 ways. Interrupters will come to the hospital to work with police and medical staff to do everything they can to diffuse retaliation. Once these survivors are out of the emergency department, violence intervention specialists will help them find the off-ramp to the chaos that's destroying their lives. Sometimes that off-ramp is education. Sometimes it's job training. Sometimes it's a home or food, or counseling, or a move away from generations of inter-family feuding. Our commitment to social well-being is why we will rebuild our McCafferty Health Center at Lorraine Avenue and West 42nd Street. That health center is home to our Pride Clinic, a safe haven for our LGBT community. It's a place where patients can obtain financial, legal, and social work help in addition to being cared for by primary care physicians and specialists. It's why we will, with the approval of CMSD Board of Education, open a new School of Science and Health inside our hospital this fall. A first in the country, we're told. Lincoln West School of Science and Health will provide Cleveland High School students with training and exposure to the hundreds of jobs available in healthcare. Jobs that will help guarantee them a sound and safe future. And it's why we will begin a supported housing program for our employees. A program that aims to move 500 MetroHealth families to our West 25th Street neighborhood in the next 5 to 10 years. It is why I signed the first-year Cleveland Covenant, a commitment to significantly and sustainably reduce the infant mortality rate in Cleveland and Cuyahoga County. And it's why, thanks to grants from generous foundations, we are building a proven nurse-family partnership program. This program sends nurses into the home of high-risk pregnant women and new moms to help their babies stay healthy and to help them avoid the devastating deaths that afflict Black families at more than twice the rate of white families. This is the program that the state helped fund yesterday when it announced a $3 million investment in 3 Cuyahoga County projects that are combating infant mortality. It's why we're opening a fresh fruit and vegetable stand on our campus this month, where our patients, our employees, and our neighborhood can come to shop. And it's why we continue to look for more ways to make our community healthy. It's why we said yes when HealthSpan asked us to take care of more than 40,000 of its patients in Cuyahoga County after it closed its practices in Bedford, Rocky River, Cleveland Heights, and Parma. Most of these patients are in their 60s and have relied on these locations for decades. They don't want to leave their doctors. They don't want to travel to new facilities. They don't want to give up their healthcare homes. And we don't want them to either. We stepped in. We're taking care of them. It's another way we take responsibility for our community. Since April, those former HealthSpan patients have come to us more than 20,000 times for care. And they continue to come through our doors, hundreds of them every day, without the worry of where to go to preserve the most valuable asset, their health. We accomplished all of that in 2015 despite new challenges. Despite cuts of $15 million from the state and federal government, despite regulations that require us to allocate extensive time, money, and staff to meeting them rather than to programs that care for the community. And last year, we accepted a $15.2 million cut in levy funds over the next 2 years to support new social programs. Despite those pressures, we have continued to provide care to everyone, and we will continue doing so even when some people don't fully comprehend the value of this, its benefits, or its impact on the region. You see, we don't do it for the glory. We never have. We do it because it's the right thing to do for everyone in Cuyahoga County. And we will keep doing it regardless of those who say that transformation, expansion are not our place. To be perfectly clear, our place is any place you find a MetroHealth patient. They are everywhere. MetroHealth patients live in Bedford and Brooklyn, Brecksville, Beechwood, and Brattonall. And they all deserve the same easy access to health care. The kind of access that encourages prevention and early treatment. The kind of access that keeps minor illnesses from becoming health crises. And today, 97% of Cuyahoga County residents live a 10-minute drive or less from a great MetroHealth care. And if we want to live our mission of creating a healthier community for everyone, increasing access is our duty. Many people have not experienced that exceptional care in those facilities still see us as the West Side Hospital. And that's not the only misconception that I have heard in the 3 years I've been here. There are others, plenty of them. Misconceptions about our patients and doctors, our finances, our charter, our sources of revenue, and our contribution to the community. Let me set the record straight. Our patients are corporate CEOs, dancers, and chefs. They are college professors, judges, and professional athletes. They are you, and they are me, and my wife, and our 3 daughters. And yes, they choose MetroHealth. They choose us for our exceptional care, for our extraordinary hearts, and for our expertise, not only in trauma care and burn treatment and high-risk pregnancy, but in pediatric allergy, hepatology, gynecologic oncology, orthopedic surgery, and so much more. The 2015 operating income I mentioned earlier proves that we are a financial success, not in spite of our recent expansion, but because of it. Also, there is no charter law that says we care for only those in need. It's what we choose to do, what we've always done and what we will always do. We don't turn anyone away in our current buildings, and we will not turn anyone away in any of our new buildings. We will never do that. That steadfast pledge lives deep in the hearts of everyone who works here. And no, we don't receive half of our funding from the Health and Human Services levy. In fact, the levy proceeds will likely account for approximately 3% of our 2016 revenue. That support, which we are very grateful for, is in reality not a handout, but a wise, prudent investment. Cuyahoga County provided MetroHealth with $40 million from the levy in 2015, and we gave Cuyahoga County back $223 million in community benefit. As an industry measure, it means we provided 24.6% of our operating expenses as a community benefit. It also means that MetroHealth gives back nearly 3 times the national average of 8.9%, and more than twice the average of the region. So, what did we do with that $223 million? We took care of the health needs of our foster children. We gave free care and medicine to those who had lost their jobs, to anyone who couldn't pay. We trained tomorrow's doctors and nurses, and we helped our community in dozens of other ways I've mentioned before. Now, I want to introduce you to Dr. Bruce Siegel, who can provide a national perspective to better explain what MetroHealth means to this community. Dr. Siegel has been selected as one of the 100 most influential people in healthcare every year for the past 5 years. He is one of the 50 most influential physician executives and leaders in healthcare, one of the top 25 minority executives in healthcare, and chairman of the National Quality Forum. Here's a short message from Dr. Siegel.
America's Essential Hospitals is the champion in Washington, D.C. for essential hospitals. Those are hospitals who care for the most vulnerable across America. There are places like MetroHealth, who take care of some very sick people and people with many challenges in their social lives, and also places that provide really special services for the community. People often see the tax dollars that go to public hospitals, but aren't always clear about seeing the benefits. You know, MetroHealth gets only about 3% of its budget from taxpayers, yet it delivers close to $250 million a year in benefit to the people of Cuyahoga County in terms of providing care that others won't provide, taking care of people and children in the schools. They go far and beyond the calling of most hospitals. You know, it's important for people to realize one thing. A system like MetroHealth is also a business. It's competing in the market with other hospitals. It has to balance its budget. The good news is that MetroHealth actually makes a profit, a small profit that it can reinvest in its services. Most public hospitals don't do that. So that really says a lot about the management of MetroHealth. To be a business, it has to compete for paying commercial patients. MetroHealth's financial health, its ability to serve will be better if it also has people coming through the door for whom it does get paid more money. You know, we need to make sure that for essential hospitals like MetroHealth, we give them the ability, the freedom to compete. Not looking for an advantage, but if we want them to be sound businesses that provide value to our taxpayers, they have to be able to compete in the market just like any other hospital. MetroHealth is going to become more relevant than ever for a very important reason. Hospitals in America are waking up to the fact that if they're going to provide really the best care and ensure health in America, they have to get outside their four walls. So they've broken out of the old mindset of what a hospital should be, We've embraced health as a community value, as a culture of health. MetroHealth is a gem. It ensures that people are healthier in Cleveland and Cuyahoga County, and that's important. Not only do we want people to be healthy and happy, we also want to have a community that's welcoming, and frankly, that continues the renaissance that Cleveland has experienced. Someone told me that MetroHealth's vision is to be the most admired public hospital in America. And I have to say that MetroHealth is pretty far along in actually realizing that vision.
As Dr. Siegel said, we are continuing to add value to this community. Earlier this week, we introduced a new HMO, CleCare, in partnership with Medical Mutual of Ohio. This partnership represents a rare and intense collaboration between a healthcare provider and a health insurer that will introduce a new value proposition in the market. That new value proposition, better care and better experience at a better cost. Up to 15% savings compared to typical insurance premiums. CleCare offers fully insured and self-insured employers a tailored network of high-value providers, committed to coordinating their efforts for the benefits of the members. The network provides care, including tests, doctor visits, and hospital stays at the rapidly expanding MetroHealth network of health centers, emergency rooms, and inpatient facilities. And we are partnering with organizations around Northeast Ohio to provide selected complex procedures, behavioral health services, and home and hospice care. The MMO MetroHealth partnership is on the leading edge of change nationwide in how healthcare is delivered. Our integrated network of providers will share clinical information to deliver seamless treatment and reduce unnecessary tests. And together, we will support patients as they navigate the healthcare system whenever they need help. CleCare also focuses on preventive care and wellness, the kind of care that results in less illness, fewer lost days of work, lower stress, and increased productivity. We're also introducing a new health offering called Select Direct that improves access and results in a significant reduction in cost for employers and individuals. With Select Direct, patients or their employers pay a low monthly fee for a list of preventive care, primary care, and health screening services provided by MetroHealth. Evidence-based health services such as age-appropriate immunization, lead screening in children, and colon cancer screening in adults, as well as mammography and bone density testing for women, and there are no co-pays or additional out-of-pocket expenses. This is a program that gives those who have high deductible or catastrophic insurance a simple, low-cost way to pay for basic and preventive care. Just as important, it gives them peace of mind. If someone needs additional services from MetroHealth, they will be able to get it at significant discounts, thus ensuring coordination and continuity of care. These are just a few of the ways we're giving people what's been missing in their lives. A few of the ways we're refusing to allow other people's low expectations of us, of our patients, of our employees, of our neighborhood, to keep us from doing everything we can to raise up and provide opportunity to those who have been denied opportunity in the past. Still, there are some who say that providing healthcare in a facility with an aging infrastructure is good enough for those people. That notion is not only prejudiced and unkind, it's self-destructive. The idea of a two-tiered healthcare system, one for the haves and another for the have-nots, is an affront to the fundamental belief that America was founded on, that all men are created equal. We are so pleased that Cuyahoga County Executive and Council also share the view that everyone deserves excellent care in efficient, modern facilities. Since last year, we've been working together to make the campus revitalization a reality. We've had teams of professionals scrutinizing our strategic plan, the design of our building program, and our finances. We are making good progress on what will surely be the largest project in our 179-year history. Together, we're addressing more than a health issue. We're addressing a community issue and a social justice issue. Social justice is why we are committed to this city, to this county, and to all of its residents. It's why we can't let our hospital fall apart with leaking roofs and failing heat. It's why, in partnership, we will rebuild our main campus. And to those who suggest we should take a wait-and-see attitude, I say waiting is folly. It could prove dangerous to the health of more than 250,000 patients we serve each year. It's a waste of money, our money and yours, and it's just plain wrong. Since 2005, we've spent $72 million patching and repairing these buildings to keep our patients, their families, and our employees safe. We spent another $204 million in new technology and clinical programs to enhance the care we provide in these buildings. And we've already spent $228 million in campus revitalization. That's $504 million in service to the community. All but $10 million of that coming from MetroHealth's own bank accounts and generating more than $700 million in economic benefit to our region. Let me repeat that. That's $504 million in service to the community, all but $10 million coming from the MetroHealth's own bank accounts. This demonstrates our commitment to our community. Rebuilding our main campus will boost the economy of Cleveland's West Side and ripple through the city, the county, and Northeast Ohio. It will create more jobs, more good-paying union jobs. It will pump millions of dollars into the local economy. It will catalyze and advance redevelopment in the neighborhood along a neglected strip of West 25th Street, from the West Side Market to the Cleveland Metro Parks, too. Only with leadership from an anchor institution can we accomplish this. A 2013 economic impact report prepared by Cleveland State University's Maxine Goodman Levin College of Urban Affairs found that rebuilding our new campus and additional capital improvements to our health system would create more than 5,300 jobs in the Cleveland-Elyria-Mentor area over the 6-year period. Labor income would increase by $249 million, with a total value of goods and services amounting to almost $680 million. Together, that would generate nearly $75 million in additional federal, state, and local taxes. So as previously mentioned, waiting is folly. The $72 million used for building repairs could have been better used to provide care to those who can't afford it. It could have helped put an end to the inequalities in healthcare we see among blacks, whites, and Hispanics. It could have helped find a solution to our embarrassingly high infant mortality rate. It could have helped reduce the gun violence that takes the life of innocent child after innocent child after innocent child. How can we view this as anything but a social justice issue, one that can't be ignored? If this presidential primary has taught us anything, it has taught us that the level of frustration between the haves and have-nots have reached a breaking point. The gap is palpable, a national crisis. And we, all of us together, can do something about it. We can help end it. It's our duty, an opportunity to lead, and something we at MetroHealth consider an honor and a privilege as we work with the county and city leaders who are tackling these important issues. With this reinvention of our campus and the care we provide, we will even be more relevant and valuable to our community. I am heartened by the support we receive from national, state, county, and city leaders and civic organizations. We are also grateful to the business community's support that helped raise $2.3 million last month at the 2016 MetroHealth Gala. However, that support is not universal. The collaboration that I had wished for and worked so hard for isn't shared by everyone. That's not the Cleveland I've come to know and love. We are better than this. We should work together to assure care for all. This can be done without picking winners and losers. We can do well simultaneously. Frankly, the data bear that out. MetroHealth, Cleveland Clinic, and University Hospitals have never been stronger, each of us contributing much to the social and economic fabric of our region. MetroHealth is committed to moving ahead. We are improving the health of this community, expanding services, taking care to where people live, work, and play. We are doing what our mission compels us to do. Not because we have to, because it's what we were born to do. And because we can't imagine not doing it. And so we will. As you can see from our accomplishments this past year, we are no longer hidden in a shadow of giants. Today, we stand shoulder to shoulder with them, all of us accomplishing things people said could never be done. My hope is that one day we will stand together, arm in arm, focus not on our individual contributions, but on the collective good we do for our county, our city, our community, our friends, and our neighbors. Because you, the taxpayers, support all the nonprofit healthcare organizations in this community. Cleveland Clinic, University Hospital, Sisters of Charity, and MetroHealth. You not only support us as our customers, you also provide us with tax breaks so we can act in the interest of public good. And it is only by working together that we succeed. To those of you who are doing that, I say thank you. Please don't stop. You are our future. A future that MetroHealth should be a part of for another 179 years, continuing the work we began in 1837 of preventing disease and caring for those who are not spared, no matter who they are. Continuing to erase the social injustice that destroys our people and steals potential and takes with it all the good we deserve. Continuing to make this a great community. The great community it can't be until everyone is cared for. The great community we are destined to be. Thank you.
We are MetroHealth.